So we're talking about prolapse today. So first let's talk about anatomy. In the pelvic cavity, we have bladder, uterus, and rectum. So if we take those out, maybe. Those are all going to kind of sit next to each other and line up like this. So the rectum is lined up, it's flush with the backside of the vaginal canal. The bladder is flush with the front part of the vaginal canal. So what happens with prolapse, we can expect that those vaginal walls are gonna get a little more lax or loose after delivering a baby. And so what can happen with that laxity is that the bladder can start to fall backwards into that front vaginal wall and then into the vaginal canal a little bit, and or the rectum can start to fall forward into the vaginal canal as well. Also, we can get the uterus sitting up here, and that can just kind of start to drop down as well. But I would say what I most often see is either the bladder, this is called the cystocele, or the rectum coming forward, called a rectocele. So that's what we're looking at with prolapse, which most often happens prenatal, or not prenatal, well, sometimes prenatal or postpartum. Can happen to people if they've had like chronic constipation and bearing down and things like that too. But I think the first thing to know is this condition in particular can be really scary for women, because I think when you hear that like, oh, your organs are falling out, it's horrifying to think, and like, what is this gonna be like when I'm 70, and what's gonna happen to me, and will my body ever be the same again? Can I carry kids again? Like, oh my gosh. Yes. For the most part, we grade prolapse in a 1 to 4 scale. So grade 1 and grade 2 mean those tissues are falling, but they're staying inside the body. Grade 3 is when they fall to the level of like the vaginal opening, and then grade 4 would be like when the tissue is like bulging outside the vaginal opening. So grade 1 and grade 2, you might notice symptoms like heaviness, fullness, feels like you're wearing a tampon when you're not, things like that. But we can often address those symptoms with physical therapy. Grade 3, grade 4, if you're experiencing that might be more of a surgical or that sort of issue, but a lot of what we're seeing postpartum can be addressed with physical therapy. What we're trying to address with physical therapy is not necessarily to make those tissues come back up, but we're looking to make you be symptom-free. You've had a baby, things might never look the same, but I do think to some degree, for the most part, unless you've had some sort of trauma, things can feel the same and they can feel good. So rest assured, there's help, it'll be okay. I had prolapse after my first child, and I just had another baby and no prolapse. I had a little bit of symptoms during pregnancy, but like prolapse symptoms afterwards, nothing. It was fine. So like, you do this. So that's one of the biggest things that I want to say. I have a post-it note here to make sure that I can address all the things. So the other thing to think then is, a lot of times we just assume that there's a lot of weakness in the pelvic floor. So we're just gonna tighten and squeeze and strengthen things, and that's gonna make things be better. Sometimes tightness in the pelvic floor can also contribute to prolapse and prolapse symptoms. So if we think of that pelvic floor as being like a bouncy trampoline, right? It needs to accommodate to your day-to-day activities. So like when you step, it just contracts a little bit to support your organs, that kind of thing. So if it's tight, it's just gonna be a rigid structure that your organs are just kind of like pounding against. So that's not helpful either. And obviously if it's weak, then those muscles aren't helping to hold up those internal organs either. So we need a happy medium. We need a pelvic floor that is relaxed at rest, but then engages and contracts to stabilize if we're going to do some sort of activity. So our goal with physical therapy is to make your pelvic floor adaptive. So without being assessed, if you're just watching this and learning about this at home, it's hard to know, like, is my pelvic floor tight? Is it weak? What am I doing? It's hard to say unless you're assessed by a pelvic floor physical therapist, which doing an internal assessment, so using one finger vaginally to palpate those muscles, give you some feedback and figure out what's going on. But if you're just trying to figure it out at home, the first thing that I would say is very easy to want to squeeze and hold those pelvic floor muscles because like, oh, I have this feeling that something's not where it's supposed to be, so I'm just going to squeeze all the time. That's going to contribute to that tightness, and it's not very adaptive. So if you're sitting, your pelvic floor should be resting for the most part. It should be not engaged. So times when you're like driving or like feeding the baby, things like that, start checking in with your pelvic floor. You can do some like nice, just diaphragmatic breathing, breathe in, breathe out. And as you do that, at the top of that inhale, thinking about expanding into abdominal walls, you know, side body, and expand down to the pelvic floor and let go and relax that pelvic floor, and just do 10 breaths to help calm the nervous system, but then also calm and let go of your pelvic floor. And if you notice like, oh yeah, I might be holding tension, and when I really pay attention to it, I can let go of that tension. Yeah, you're probably holding pelvic floor tension for parts or all of your day, so bring more awareness to that. So that's the first thing that I would say. And then the other aspect of this is that we're wanting to manage pressure in this abdominal cavity. So this is our pelvis, pelvic floor, muscles on the bottom. And I think of your core as a canister. So if we have pelvic floor on the bottom, diaphragm on top, abdominal muscles in the front, low back muscles in the back. We want all of those muscles to work together. And if you think of it as like a soda can, actually let's think of it like a balloon. If you squeeze that balloon around the middle, you're gonna create pressure upward and downward, right? If you squeeze here, it's gonna go this way. That's what we wanna avoid with prolapse. So if we are over engaging, or if you just go to like lift something up and you bear down into your pelvic floor, it's gonna push those organs downward. So ways that we can think about pressure management. First things first, with going to the bathroom, pee and poop, make sure that you're not bearing down. So pee, sit, relax, take some nice deep breaths, and just allow that pee to flow out. I know we all want to like rush, hurry, so we tend to like bear down and push pee out. Just let it go. With bowel movements, we want to make sure that A, you're not constipated, so you're not having to bear down a ton with bowel movements. So diet, getting enough fiber, making sure you're drinking a bunch of water, those sorts of basics for constipation management, making sure that poops are soft and you're having one daily and things like that can help, so you're not bearing down. Using a squatty potty with bowel movements, so like any sort of stool so that your knees are higher than your hips is going to help lengthen the pelvic floor and make that bowel movement easier to get out, so you're not having to bear down as much there as well. If you are having constipation, or if you feel like when you go to the bathroom, when you go poop, that you can't get it all out, or the last little bit gets kind of stuck, it might mean that you have that like rectocele, that rectum is dropping down into that vaginal canal, so you can't actually support in the perineum, so the external pelvic floor muscles fell off. But vaginal opening, anal opening, we can put our fingertips in that space between anal and vaginal opening, and when you have a bowel movement, just reaching between your legs, pushing up in that perineum just to support that tissue, to help get that full void out, and also avoiding having to bear down and supporting that tissue instead of bearing down against it. So that can help. And then lastly, for pressure management, every time we're exerting ourselves, we want to make sure that we're using that exhale and engage pelvic floor and core to help lift and support those organs and tissues instead of bearing down against them to create stability, which I see a lot in people. So that means like sit to stand, getting off the couch, especially when you're holding a baby. We exhale, squeeze and lift pelvic floor, low abs. Picking something up off the floor, we exhale, squeeze and lift pelvic floor. So like thinking about lifting up the car seat, getting the baby out of the crib, even just like lifting something moderately heavy, lifting your toddler, all those things. We're bringing awareness to this core pelvic floor area. We're exhaling with exertion. That's how we can remember it. Exhale with exertion and engage those muscles. So all those things are going to help manage pressure so we're not bearing down into those organs and making prolapse worse. And then we want to get those pelvic floor muscles functioning optimally. So again, that might mean loosening tissue, which would mean in physical therapy, we're using one finger vaginally to palpate and kind of trigger point release of pelvic floor muscles. At home, you can do internal pelvic floor release manually with like a thumb, a wand, a fingertip. I have a video on that if tension is something that you're dealing with. But then, so I always think mobility before stability. So if you have tightness, you want to mobilize and get those pelvic floor muscles functioning optimally, all the way contract, all the way relax. Once we've achieved that, then we can start to introduce some stabilization. So core stabilization, pelvic floor stabilization. So I'll just give you two exercises to start with along those lines. I have a whole bunch of strengthening videos uploaded, so we can put that, you can go over to find those strengthening videos somewhere else, because it's not just pelvic floor and abs, is glutes, even upper body sometimes getting stronger there. So it's really a whole body approach to getting stronger and stabilizing so that we're taking the load off of those pelvic floor muscles and those pelvic organs. But as a starting place, let's talk about candle breaths, which again I have a video on. We'll just review it really quickly, but this is where we're going to find that exhale and engage. So on the inhale, we're lengthening and relaxing. On the exhale, we engage pelvic floor and low abs. So when we inhale, we're doing a 360 rib cage expansion, 360 abdomen expansion, expand into the table. On the exhale, we're going to squeeze like a tube of toothpaste. This is where people tend to like bear down or like start with engaging here, which is just going to put pressure down onto the pelvic floor. So on the exhale, you're going to think about squeezing like a tube of toothpaste. Squeeze that air out like a tube of toothpaste. So pelvic floor, low ab on that exhale. So nice breath in. Exhale, pelvic floor, low ab as you lift from that bottom up. And so I'm showing you in laying, but you can certainly do this in sitting, like feeding. And then also in standing, we want to have these muscles engaged a little bit as well. So 10 reps while you're laying or sitting just to practice and find those muscles, but then applying this to all of your standing daily tasks. So once we have that, then we can try some marching. So again, I have another video on just like transverse abdominis activation with marching, but I'll show you here. So we're gonna use that inhale, exhale. Inhale, lengthen, expand, exhale, squeeze in, lift pelvic floor. You're gonna march this knee up, inhale, back down. Exhale, lift, pelvic floor, low ab, lift that knee, inhale, down. What's the goal here? Keeping that pelvis nice and stable. As you march from side to side, your pelvis is gonna wanna kind of drop from side to side. You're trying to engage and stabilize and keep things nice and rigid, okay? So that's marching. Those are two nice exercises just to find those core muscles and start to get familiar with them and turn them on during daily activities. The final thing I'll say is we can do something called wedging to help those, if you're feeling, especially towards the end of the day, prolapse can get worse. You might feel achy, you might feel more of that heaviness, you might feel more of that like tampon sort of feeling, or it might be midday, right? Maybe I lifted something heavy or I had a bowel movement that was difficult to pass and now I feel more of those symptoms. We can do something called wedging, which really just means I'm gonna use two pillows here. One pillow, two pillows, so under your hips, get those pillows. So we're trying to just get our hips higher than the level of our shoulders. So we're using gravity to help pull those organs down out of the pelvic cavity. And often I like to put my knees up on like a couch or a chair or something like that, just in 90-90, not holding them there, but like resting them there. I don't have a chair here, but so everything is passive. You just relax. You're not contracting or engaging anything. And then you practice that diaphragmatic breathing. So we inhale and lengthen down into pelvic floor and abdominals and
sometimes in this position I will use my hands to kind of massage up on those organs. Just thinking again about pulling those organs up out of that pelvic cavity can be nice. 5 or 10 minutes. It's a nice place to breathe, relax, reset your nervous system as well. Again, either at the end of the day if you're feeling heavy or anytime that you're feeling symptomatic. And one other way that you can help to
manage that heaviness symptom, if you're having a day that's just like, ugh, this feels so annoying, you can actually like mobilize that tissue back up. So pubic bone in the front, the bladder is going to sit more forward. So if you were to put one finger vaginally and then curve up and in, you're going to be pushing on the bladder. Right at 12 o'clock, if this is a clock, right at 12 o'clock, that's where your urethra sits. So if you go off to the side of that at like 1 o'clock and 11 o'clock, you can just kind of mobilize up and in and just like push that tissue up. Similarly, if you're feeling more of like a rectocele, if you feel it with bowel movements, that kind of thing, you can, right at 6 o'clock is rectum, so we're gonna be at like 5 o'clock or 7 o'clock, and you can just like mobilize up and in. I guess back and in is what I would say, but really just shoving that tissue back up, right? And that can make those symptoms feel a lot better immediately too. So those are some things. Let me know if you have any questions in the comments. That was a lot, but prolapse can be a lot. It can be scary. It's okay. It can be addressed.